Hello, this is the second part of the presentation, heart disease and the commonly performed procedures and the stuff you should definitely know. Now, in the first part of this presentation, we've learned about coronary angiogram, what it means, how it's done, and that this procedure will actually give us information about any blockages in the blood supply to the heart muscle. Then we also learned about angioplasty, also known as balloon angioplasty. Procedure similar to an angiogram, except that in this procedure the blockage is taken care of or flattened by a balloon that is inflated once it reaches the site of blockage. Then we also learned about angioplasty with placement of stents. Mostly this is the procedure that's being preferred by cardiologists these days. So the stent is released at the site of blockage and it will stay in the coronary artery permanently in an open position, so it can open up the blood vessel and keep it open. And that at present there are two main types of stents that are being used: bare metal stents and stents with drug coating on them. And of course there are always newer types being released into the market. Now coming to the next procedure, bypass surgery. This surgery is also called CABG or coronary artery bypass grafting. Now in this surgery, a cardiothoracic surgeon will use a graft to bypass the blockage, the blocked area in the coronary artery, by sewing this graft one end above and the other end below the blockage. Now this graft is actually a vein that is taken from the leg or an artery that is in the chest wall. So as you can see, this is much more complicated than doing an angioplasty or angioplasty with stent procedure. This surgery is considered to be the treatment of choice if there are multiple blockages that are detected at the same time, or if the blockages are so extensive that they cannot be opened up with balloon angioplasty, or if one of the main blood vessels that supplies blood to the heart muscle, and this would be the left main coronary artery, if it's blocked, then angioplasty would not be of any help. Bypass surgery will need to be done in those cases also. Now we've talked about the different procedures. Let's briefly talk about the role of lifestyle and medicines after having a heart attack, with or without a procedure being done. Lifestyle changes are an absolute must. Exercise such as brisk walking for 30 to 45 minutes daily is extremely important and will have to become a part of your daily routine. You should take your medicines as prescribed. Now, it's always a very good idea to discuss with your cardiologist regarding the medicines, understand the purpose of each medicine being prescribed. Also remember that for every costly medicine that is being prescribed for you, there are in most cases cheaper, equally effective generic alternatives, meaning medications that do not have that specific brand name. Find out if they are suitable for you. This is important because these medicines for many have to be taken lifelong, and the costs do add up, especially if you're taking multiple medicines daily. Now it is your duty and responsibility to inquire about any serious side effects that you will need to be aware of. Now your doctor should explain also without you asking, but in most cases unfortunately that doesn't happen. So you should find out with the different medicines that you're taking if there are any important and serious side effects that you need to be aware of. Now I'd like to ask you a question. If you have had a heart attack, or if you have had a procedure such as an angioplasty or bypass surgery, are you meeting your targets? What are these targets? Your blood pressure needs to be under control, and that control number is 130/80 or less. Lipid profile should show the following numbers. Your total cholesterol should be less than 200, LDL cholesterol less than 70, triglycerides less than 150, and HDL cholesterol more than 40 milligrams per deciliter. If you have diabetes, it needs to be under good control. That means your hemoglobin A1C will need to be less than 7%, and this is applicable for most people. Now if you are overweight, certainly losing weight is vital. You should not smoke. If you've been a smoker before, absolutely now is the time to quit. And no tobacco use of any kind, please. And physical activity is so very important that I'm going to have to say it one more time. For at least 30 to 45 minutes daily. And of course, if you're doing much more than that, that's even better. And it's so important also that you eat healthy home cooked food always, so you can meet your targets, the ones that I've just talked about, with ease, without any significant problem. And I've talked in detail about the different things that you will need to do to keep these numbers under control in topics pertaining to the various medical conditions. You may want to see those to get more information. Now I'd like to talk briefly about diabetes and its effect on the heart. There is no question about this. Diabetes increases the risk for heart disease. Now if the control is poor, the risk is higher for a heart attack. Diabetes can hasten the formation of blockages in the arteries. Again, if the control is poor, this process happens a lot faster. Unfortunately, if someone has had diabetes for a long period of time, they may not have the usual symptoms of a heart attack. We associate crushing or severe chest pain as one of the symptoms of a heart attack. Because of damage to the nerve fibers that supply the heart muscle, you may not have these symptoms if you've had diabetes for a long time. And again, with poor control, it's quite possible that multiple coronary arteries, remember that the main coronary arteries divide into smaller branches, as you can see in the image in the lower left hand corner. So basically, multiple arteries might be affected simultaneously by plaque formation if the control is poor for diabetes. And certainly this will make treatment with angioplasty very difficult, and oftentimes bypass surgery will become necessary if the blockages are significant. And the take home point from this slide would be that good control will help prevent most of these complications. Make sure that you maintain your hemoglobin A1C below 7%. And I'd like for you to see the topic type 2 diabetes, and in which I've discussed in detail the various steps that you can take or you should take for good control. Lastly, a few words of caution. These days, procedures are being done, unfortunately, even when they are not actually needed. Stents are being placed indiscriminately, and we hear in the news articles about this happening fairly often across India. Make sure that you choose a cardiologist with a good track record, and don't hesitate to get a second opinion if necessary. Ask questions. That is your right and your responsibility. Understand why a specific procedure is being done. What is the indication? What does your doctor tell you? Now, this is the general rule of thumb. There is again always exceptions to this rule, but typically for single vessel blockages, medical treatment is usually effective. Medical treatment meaning medications to help control blood pressure, cholesterol, diabetes, and so on, and taking medications such as aspirin and others to keep the blood flow going. Now, there is one major exception to this rule, and that is that if there is a blockage in the left main coronary artery, then angioplasty is not even effective. Bypass surgery will need to be done. And there are certainly other situations when this may not become actually applicable. So your cardiologist will be able to talk to you about those situations. So again, going by this rule of thumb, if there are significant blockages in 2 or more arteries, now bear in mind that there might be blockages that are not significant, meaning there is some plaque formation but it is not really obstructing or impeding the flow of blood through the blood vessel. So in those situations, medical treatment, meaning taking different medicines to help control cholesterol and blood pressure and so on, will actually help enough that you won't have to go through any special procedure. Lifestyle changes will certainly be extremely important in these situations, because that can make a big difference in terms of not having any problems in the future. So basically, if there are blockages in 2 or more arteries, procedures such as angioplasty with or without stenting and sometimes bypass surgery will be recommended. Again, this is a decision that your cardiologist will make based upon the findings of your angiogram. No matter what happens in terms of treatment, it is extremely important that your lifestyle play a key role in preventing any problems in the future. Staying active, exercising on a daily basis, brisk walking for at least 30 to 45 minutes every single day, in addition to your normal daily activities. Making sure that you're eating healthy, home cooked food almost all the time. Consuming less of saturated fats. Eating more vegetables, eating more fruits. All these will go a long way in preventing another major event in your life. Now, I didn't talk about stress much in this topic, but if you go through my presentation on heart disease, I've gone over the many lifestyle related issues that tend to increase our risk for heart disease and what you can do in order to improve your chances of not having a heart attack. Thanks for listening.